I'm Laura, I'm one of the vets from B&W. I work from the Failand clinics, just doing ambulatory work. And probably as you can tell from my accent, I'm from the north of the country, so I'm from Yorkshire, but I've lived in Bristol and the Bristol kind of area now for about nearly 3 years, and worked in the area for about 3 years now as well. I've been at B&W about a year now,
Right.
So not too long. I worked in the area before and in a hospital, but actually I realised that when I worked in the hospital I missed getting out and about to people and actually interacting with people. So when you're in a hospital, often you just get the horses and you don't get to interact with clients and don't get to build a relationship with horses. So I moved back into ambulatory practice away from hospital practice just so that I can build a relationship with the owners and with their horses. Yeah, I've always worked with horses in a veterinary capacity. I had horses from being very young, so from 3 years old, and I kind of thought when I became a vet I wouldn't want to work with them. I wanted to keep them as a hobby, but actually it was just a really natural progression. Like, it comes quite naturally being with horses, you know how to act around them, so it becomes easier to work with them, whereas cows and farm animals are not for me. So it was quite a natural progression, so I've always worked with them. I guess the biggest difference is working within a team at HorseWorld. Normally on yards you work with individual owners and kind of it's just one horse, whereas here we can't just think of one individual horse, we have to think about all of the horses. So however many we have here, we have to think of the herd as a whole rather than just trying to fix one horse. We have lots of different problems here and lots of different things to do, and we're all part of a team working towards that one aim. I guess the biggest thing here as well is that you see such a range of things. We have routine healthcare that we do on a weekly basis, such as vaccines, worming, mite injections as we've seen today, blood samples that you would see routinely on normal yards as well. But actually the other perspective that you don't see is we deal with the rescues, the abandonments, the horses that are really badly neglected and horses that are really sick. So you do see the real spectrum of it, and actually you see it a lot. It's not just an individual owner might ring you once a year saying the horse has cut their leg. Actually here it's every week we have something different to deal with, and I guess that's because the horses come from all walks of life. We have horses that have got old with their owners and the owners can't look after them anymore, to horses that have been rescued and seized. So we do see a vast spectrum, and that's why we see so many different problems. There's lots of reasons that I like coming to HorseWorld. From the horses, you actually feel like you make a really big difference, especially in the ones that have had a really rough start. You kind of all grow together. For example, Sydney, one of the horses that's come in here, you just see such a change, and you see them grow with the people as well as get better in their health, and I think that's quite rewarding. And also it's really nice to work somewhere where everyone is so dedicated into the horse's health, whether it's just looking after the older ones or gaining the trust of ones that are really nervous. Kind of everyone's just a big team, and I guess sometimes when you work with individual people you don't have that team aspect, but here everyone's working towards the same goals, so that's probably the best reason for working here. Augusta is due to go to a new home to be with one of her friends, and so before the horses get rehomed they have to have a full health check and basically be suitable for the purpose that they're going to be rehomed for, so whether that's ridden work or just to be a companion. So we know that Augusta is going to be a field companion with another horse that she knows really well because it's from HorseWorld. So we're making sure that basically she is suitable for that purpose. So we check their hearts, check their lungs, check their bellies, check their mouths, and make sure that if they have got any problems that they're under control and that aren't going to become out of control when they go into these new homes. So for Augusta, occasionally she can be a little bit sore in front and her feet, but actually today we saw that she's looking good and is fine to go out and be rehomed. Lolly had to have a tooth out and she went up to our hospital to have that removed. Once they have the tooth removed, as you can see with the size of Lolly, she's very big, so she has very big teeth, and so same as in us, if you remove a tooth you're obviously left with a gap and a hole, so that hole has to be filled. So it's filled with kind of a putty substance, and after 2 weeks of the surgery you hope that the gum is healed well enough and that putty can be removed. So we've just taken that putty out of Lolly today and had a good look to make sure everything's healing well and given it a good flush, and then pop some more putty in to allow that gum line to continue healing, because at the moment it's not completely healed. I guess I really enjoy when we get horses in that are really nervous, and I guess this is not even really that veterinary related, but we work with them and they just become so much easier to handle, and like from week to week, even when they have a problem, you can see that they're just gaining trust. And I think that's the nicest part. You see that they have their individual workers that help them and they bond with them, and actually one day they might not let you touch their back legs, but actually you come a week later and you can pick out their feet, or you can palpate their stifles or any part of their leg, and actually that's probably the most rewarding part, even if you're not fixing a problem, just actually being able to even just examine a horse. Because I think what a lot of people forget is if you can't handle a horse and then that horse then gets very sick, we have no chance to even be able to treat them. So actually the handling is probably the most important part, and the work that the girls do here to achieve that handling is the most important work really as well. Even if you can't do anything more to help the animal and you end up putting them to sleep, which is the worst part of the job, the saddest part, actually you're still helping that animal. And I think that's the thing that I always focus on, is that whatever you're doing, you are aiming to help the animal and make it more comfortable. And I think that's how I process things, is that I just know that I'm working to help them rather than we're just trying to stop the suffering.
Sydney's story started about 2 months ago. We got a call from the RSPCA to say that they had had a dog walker report an emaciated horse to them. They'd gone out to have a look and found an extremely emaciated thoroughbred gelding who had his rugs, 2 rugs, left on him since last November and had not been checked by his owner since May when they found him. Both rugs had worn huge wounds at the top of his withers, which had then got infected and oozed pus out of the infection and down the sides onto the sides of his shoulders, which underneath the rugs in the heat that we had when we had the heat wave, then created burns to his skin. So as well as having a huge open wound on the top of his withers, he then had burns going down either side of his withers, down onto his shoulder blades. And this was underneath 2 rugs. So when the RSPCA got there and they took the rugs off, you can imagine the condition that they found him in. He was extremely emaciated. Body score 0.5, very, very underweight. Thoroughbred horse as well, so you'll find a type of breed. And they immediately got a seizure warrant and got him seized and with the police's help. Got him seized and he moved to a boarding facility for a temporary 3 weeks. At the time, we couldn't take him here at HorseWorld. And after 3 weeks, he came into us. So we arrived here on the 12th of June from his boarder, and she had done a wonderful job with him already, treating his wounds 4 to 5 times a day, flushing them out, because we had to try and flush the infection out through the withers and out through the shoulder. It wasn't a pretty sight, even when he came to us after 3 weeks of her having him. So he then came to us in the middle of June, and we just continued with his treatment, really. So we continued with the flushing and the cleaning of the wounds daily. He also had a wound to one of his back legs as well, so we flush and clean that daily. Then we had to start looking at his diet. So we looked at making sure that we tried to introduce grass. Grass is really important in a horse's diet. It's a natural thing that they would eat. So we try not to get them to have too much concentrated feed, especially if they're not used to having it. So we have to introduce that really slowly. So we got grass into his diet by hand grazing him to start off with, and then we introduced the correct concentrated feeds so that he could make the best and the most of what he was eating. Like I said, he was having his wounds flushed twice a day. And then cleaned at lunchtime as well. So 2 lots of flushing and an extra cleaning when he was having his lunchtime food. As well as the flushing of the wounds and the cleaning of the wounds and the correct care and diet for him, it was just basically about trying to get weight back on him and keeping those wounds clean. The daily care for him was like a normal horse, as in he was kept in his stable. We'd muck him out in the morning, he'd go out for a little bit of hand graze. It was just the extra veterinary care that he was needing on top of that. Obviously when they first come in, we have to do all of the checks, so they go straight into isolation. They don't mix with the rest of the horses that we have here at HorseWorld. And one of the tests that they have done is something called strangles. So we had bloods taken for strangles, and his actually came back slightly raised, so it meant that he had to stay in isolation longer, and then we had to organise and arrange to have a scope done. So they put a tube and a camera down his nose into his guttural pouches, and they look at his guttural pouches and see whether there are signs of having strangles or not. He didn't have any signs. He had a flush taken from that, and that came back negative. So the raised antigens in his blood from the strangles blood results was probably showing that he's had it at some point in his history. He's over 20. We're not exact on his age, so he has probably had it at some point in his life, and that's why the blood results were showing a little bit of race, that's all. As well as having that, he's seen the farrier, he's been wormed. He's seen the dentist briefly. He has quite a lot of ulcers in his mouth where he's not had his teeth done regularly. Horses are meant to have them done every 6 to 12 months. But because of the complications with his withers and the fact that he's so underweight and so thin, he didn't really like the dentist very much, but we don't want to give him too much sedation while he's still very weak. So he had about 10 minutes of work done just to take off the worst of the sharp parts of his teeth. We didn't want him raising his head too much and putting too much pressure on the withers while they're still very sore. So he just had the tops of his teeth taken off, and then when he's a bit stronger, to have some sedation just to keep him calm, he'll then have his teeth done properly again in a couple of weeks' time now, because he is getting stronger. And yeah, general care then really. From there, we make sure we weigh him kind of every couple of weeks so that we know he's putting on weight. And he is putting on weight. He's putting it on steadily, slowly but steadily. So it means that he's going in the right direction. He's not piling it on too quickly. Biggest mistake sometimes that people can do is when they have a very underweight horse or any animal, they just want to pile them full of food. Well, when the stomach's shrunk to the size that an emaciated horse's stomach would have, and they're not used to having food to digest all the time, if you give them lots and lots of food straight away, then you can just create more problems. In particular, colic. You can get impaction colic because the stomach hasn't been used to working, and then you go and pile lots of food into them and get them to eat lots. Yeah, you can make them quite severely ill. So you have to make sure they have little and often feeds, and then you build it up from there. So he's on 3 big feeds a day now, as well as going out on the grass all day, and he seems to be thriving on that. So his general health is okay. He's an older boy, so he's got a bit of arthritis in his back legs already, and his hind legs. The withers, when he was first at the boarding facility before he came here, he had x-rays done, and we've just had x-rays done again last week on the withers to check the progress. So basically the infection that was in there, we want to make sure, or we want to know what's happening with it in regards to the withers and the bone that's underneath the wound. And the x-rays that we had taken last week weren't as great as we were hoping. They were still showing that there is quite a bit of infection in there, and it's very near the bone. So we're going to try a slightly stronger, more aggressive antibiotic for him, but we're just waiting on the vets to get back to us after one of the specialists has looked at the x-rays to decide which antibiotic to try him on in regards to that. The other wounds are healing. They're healing slowly. The burns on the side of his shoulder, one's almost completely healed up, but one is taking a little bit of time. That's just having cream on it daily and cleaned off, and it's just going to be time for that to heal. It's a burn wound, so it's just going to take a while. Like I said, he's putting on weight nice and slowly. He's bright, and he's happy in himself. He's had a couple of baths, so he's going in the right direction. He's still got a long way to go. He's a gentleman in any way. He's very sensitive. You can tell at some point in his life he has been owned and he has been cared for, and he has had manners. He's very well behaved. He doesn't question when you ask him to do something. He's the treatment throughout the whole of this. He has never once walked away from us trying to treat his withers. Even when we were flushing them out through the withers and out through the wound, he didn't have to be sedated or anything for that. He just stood there and ate his food. So he's been an absolute gem to treat. like I said, he's a gentleman, he's very polite, he doesn't ever put a foot wrong, he doesn't ever say no, he just kind of gets on with it and does what you ask him to do. So in respects of as a patient, he's an absolute angel. I can imagine when he gets a little bit better and he starts feeling really good about himself, give him another couple of months, I can think he'll have a cheeky side, but alone it'll be a lovable cheeky side, it won't be kind of like a naughty cheeky side.